Hello everyone, I'm Dr. Wang from Beijing University of Chinese Medicine. Today we will learn about the traditional Chinese massage, Tuina. I will mainly explain it from the following three aspects. A brief introduction of Tuina, main types of Tuina, and some iconic Tuina techniques. Let's start with the most popular natural therapy in the world. That is massage. It is no exaggeration to say that massage is the most widely used treatment around the world. There are more than 10 mainstream massage therapies which are used in a wide range of medical and health fields, like muscle relaxation, relieve stress, treat diseases, and hospice care. Some massage therapies, including Swedish massage, deep tissue massage, and sports massage, are more often used in Western countries. These massage therapies are mainly based on anatomy and achieve the purpose of treatment by stimulating the corresponding nerves, muscles, joints, and bones. The theoretical basis of Oriental massage is completely different. From Tuina, acupressure, shiatsu, to Thai massage, and all based on traditional Chinese meridians and channels theory. So that's why Chinese way of massage can be applied not only in musculoskeletal disorders, but also in many internal diseases. And we normally call Chinese massage as Tuina or 按摩. Tuina is oriented in ancient China and is believed to be the oldest system of bodywork. At the beginning, after being tired or unwell, people instinctively beat and rubbed certain areas on their body and found that they could effectively relieve the symptoms of discomfort. Later, with the continuous improvement of the meridian system, Tuina techniques gradually enriched. It has become an important part of external treatment of Chinese medicine. Do you know what these symbols below are? Yes, they are the ancient Chinese characters. You need to know that Chinese characters have certain ideographic attributes. Then these Chinese characters are actually ancient Chinese characters for massage. And they are read respectively as 推, 拿, 按, 摩. 推 means push, 拿 means grasp, and 按 means press, 摩 means rub. Can you see which part of these characters have in common? I believe that if you look closely, you will find that they all share the same part of this. So, would you please make a guess? What does this mean? Yes, this represents a man's hand. Then no matter you know the characters or not, you realize these characters are related with hands. So if you are learning Chinese, when you see a hand mark in a word or in a character, you can more or less guess that it is basically related to a hand movement. Most of the time, we use our hands stimulate the flow of qi to promote balance and harmony within the body. Target specific acupoints or meridians. Tuina practitioners use fingers or other parts of the body instead of needles to apply pressure to stimulate the targeted specific acupoints or meridians. In fact, Tuina is one of the 4 main branches of traditional Chinese medicine, along with acupuncture, qigong, and Chinese herbal medicine. At present, the clinical treatment of Tuina is divided into three major academic genres according to the types of diseases. They are musculoskeletal Tuina, 脏腑 Tuina, and the pediatric Tuina. In terms of musculoskeletal Tuina, we focus mainly on two kinds of problems. The first is motor system diseases, like many forms of acute muscle injuries during exercise or housework. And the second is degenerative osteoarthritis, like cervical spondylosis, sciatica, non-specific low back pain, cervical or lumbar disc herniation. Next is 脏腑 Tuina. 脏腑 roughly means organs in Chinese. So 脏腑 Tuina is a Tuina method for internal diseases, including functional dyspepsia, irritable bowel syndrome, insomnia, primary dysmenorrhea, senile urinary incontinence, etc. When performing 脏腑 massage, we do not require that the technique must touch the relevant organs. More often, it is through the meridian system of our body. Work at abdominal and back area and use some relatively gentle Tuina techniques to treat diseases. The last type is pediatric Tuina. Compared with the previously two types of massage, pediatric Tuina has a more distinctive theoretical system and techniques. Most of its acupoints are concentrated on our hands and upper limbs. For instance, our 5 fingers represent different viscera. There are also a large number of acupuncture points on our palm and back of our hand. I guess such a distribution of acupoints is convenient for clinical operation. Secondly, children can see what the doctor is doing and won't be scared. In fact, the acupoints of pediatric massage also exist in adults. But as we grow up, the frequency of our hands receiving external environmental stimulation gradually increases, and the sensitivity of acupoints on our hands decreases. So that is why these acupoints are not commonly used in adults. The techniques of pediatric Tuina is relatively simple, and there are certain requirements on the frequency and the speed of operation. Sometimes applying a technique on certain acupoints has to be repeated 300 times or even 500 times. Okay, the above are the main types of Tuina. Unlike the massage genres in other areas of the world, Tuina is performed relatively more therapeutic than relaxing. Of course, it can also be used to relieve stress and relax muscles, but in hospital, we use it as the treatment for specific diseases. Next, let's take a look at what the iconic Tuina techniques look like. According to traditional classification, we divided Tuina techniques into 6 categories according to their movement features. They are swinging, rubbing, pressing, patting, shaking, and joint articulation. The first 5 categories are mainly used on soft tissue, such as muscles and ligaments. and the last one is mainly used on our joints. There are about 30 common used techniques. We will not be able to introduce all of these techniques to you in a limited time. So today, I just want to introduce 3 most iconic techniques to you. They are thumb pushing, rolling, and vibration. And thumb pushing are mainly for point stimulation. Rolling and vibration can act on wider range. We basically use these 3 techniques every day in our clinic work. We all know that there are thousands of massage techniques around, but no matter where you learn or experience them, as long as you see someone using these 3 techniques, the guy must have learned Tuina before. There's an old Chinese saying goes, when you drink water, don't forget where the water came from. So I want to introduce the inventors of these magnificent techniques to you. Let's look at the first technique, thumb pushing. It was invented by Dr. Ding Fengshan back in Qing Dynasty. It is said that his master Li was proficient in Shaolin Kung Fu. Ding nearly died in an accident when he was young and was rescued later by Li using the technique of Tuina. So he worshipped him as a teacher, learned the technique, and finally brought this technique to Shanghai, where it was carried forward and used to treat various diseases and benefited many local people. Thumb pushing is not only the most iconic Tuina technique, but also the most widely used technique in clinics. Let me demonstrate it for you. First of all, we have to relax our shoulders and elbows and hang up our wrist. Touch the treatment area with your thumb and then use the forearm to drive the wrist joint to perform a flexion and extension movement. Extension and flexion. We do it alternatively. And thumb pushing can be applied on almost any part of our body. You can do it at the neck area, shoulder area. Thumb pushing can be applied on any part of the body. It can relax the muscles when a small force is applied, and stimulate acupoints when a larger force is applied. Let's take a look at a small video below. It recorded several famous Tuina masters doing thumb pushing, and we could see their calm and contented state when they performing the tech.
一指禅推法，用拇指的指端或指纹面着力，运用前臂的摆动，带动拇指做身躯运动，使所产生的功力持续不断地作用于施术部位或腧穴上，称为一指禅推法。一指禅推法是一指禅推拿流派的代表性手法。一指禅推法通常先在米袋上练习。根据拇指着力部位的不同，一指禅推法可分为指端推和指腹推两类。 拇指较挺直者一般采用指端着力的一指禅推法，而拇指指骨间关节背伸幅度较大者，可选用指腹推。
Okay, you may see that these masters are very natural and calm when they perform the technique. In fact, I believe that technique is also an externalization of our state of mind. The technique of an impatient people will be hurried, and a calm people's technique will be elegant and graceful. Later, I will introduce the core elements of technique. Next, let's take a look at the second technique, rolling technique. The inventor of this technique is Ding Jifeng. You may already found that Ding Jifeng and Ding Fengshan share the same surname. Yes, Ding Jifeng is Ding Fengshan's indirect great-grandson and is influenced by the whole family. Because the big family of Ding has a long history in the medical field, combined with his high talented skill in Tuina, a new technique called rolling was invented. Although this technique looks very different from thumb pushing, in fact, they belong to the same category. Rolling is often used to treat large muscles like gluteus, quadriceps, erector spinae, and complement with thumb pushing. Let me demonstrate the operation of the rolling technique. First, we also need to relax the shoulder and elbow. Put the back of the hand at the little finger side close to the treatment area. And then use the forearm to drive the wrist joint to perform flexion and extension movements. During the process, the back of the hand should be always attached to the treatment site and cannot be moved. It also has another version. When we operate on a platform that is significantly lower than our elbow, we use our interphalangeal joints to stick to the treatment area, adding part of our body weight on it, and let the forearm drive the wrist joint flexion and extension. Flexion and extension. This technique is mainly used to relax large areas of meridians and muscles. Finally, let's introduce the third technique. It was invented by my teacher's teacher, Professor Zhang Fuke. The traditional vibration technique is difficult to operate and easy to get tired. Professor Zhang has been thinking about an alternative way of vibration, which is simpler and more long-lasting. And finally, he realized a brand new way of exerting force during a basketball workout. During operation, imagine you are patting a basketball in a small range. With the shoulders in a relaxed state, the flexors and extensors of the forearms contract alternatively, which significantly prolong the vibration time. The force is soft and lasting. Nowadays, Professor Zhang is more than 80 years old. He still works at the hospital, which is much respected. With the continuous development of this technique in recent years, it has been widely used in the treatment of insomnia, functional dyspepsia, IBS, type 2 diabetes, and other neuroendocrine diseases. Next, I will operate on the model. First, place the palm of your hand naturally on the abdomen and let the middle of the palm face to the patient's navel. Note that we must not shrug our shoulders or add extra pressure. Just rely on the weight of your arms. And then the forearm starts to do active flexion and extension, as if you are patting a basketball. But the range is smaller and the movement is more gentle. The palm can rise and fall appropriately, aligned with the patient's breathing. So, the above are the 3 iconic Tuina techniques that I want to share with you today. They are very characteristic and effective and are the most commonly used techniques in musculoskeletal Tuina and Zangfu Tuina. But if you want to do it well, it takes time to practice. A qualified technique must have at least 5 basic requirements. That is, penetrative, powerful, lasting, even, and gentle. For a beginner, being powerful is easy, but if you want to keep it gentle at the same time, which is a little bit hard. Not to mention adding even and lasting. Although we cannot master the Tuina technique through a single lesson, we should at least remember the key elements of a qualified Tuina technique. Now, I want to talk about a very important thing when doing or practicing Tuina, which is self-protection. We should not allow ourselves to be injured after patient is cured. Let's take a look at these 3 people below. Which one do you think has the correct posture? Which one is not? The 3 people all appear to varying degrees humpbacks, bowing their heads and shrugging their shoulders. If this continues, over time, our backs, waists, and even shoulders will suffer chronic injuries and muscle stiffness. Therefore, when we perform Tuina, we should keep our back straight, tighten our abdomen, and raise our head in order to make our spine in a neutral position, since a correct posture can not only better show the efficacy of our Tuina techniques, but also reduce our fatigue at work. At the end of this class, I want to remind everyone of contraindications of Tuina. We all know that everyone loves Tuina, but in the following situations, we should pay extra attention and not rashly perform Tuina. Apart from this, sometimes during the treatment, when the patient has symptoms such as dizziness, nausea, and excessive sweating, we should immediately stop the operation and let the patient lie down and rest. Generally, these patients may be hungry before treatment, or sleepless, lack of energy, or have some neurological diseases, such as epilepsy. So we should be very careful, and when necessary, we should also perform some related imaging examinations. These are all the patients I have encountered with severe spinal cord diseases in my clinic. For people like this, we should better be discreet to prevent aggravating their condition. Therefore, only by clarifying the relevant medical history of patients and carefully observing their physical conditions can we ensure that we provide patients with safer medical behaviors. These are some useful knowledge of Tuina techniques that I want to share with you today. Hope you enjoy it and have a nice day.